Good afternoon, good morning, and good evening to all of you who have joined us at this WHO convened UN Food Systems Summit Dialogues Health Talks, which explores the connection between food systems and health and why food system transformation is essential to achieve the human right to health and well-being for all. Welcome to Getting Food Systems Right from the Start, how they are failing young children and what we can do about it. If there were ever a foundation-setting health talk in the context of food systems, it's this one. Today, we're going to hear from the world's leading experts on first food systems. We have an incredible lineup of presenters who will delve into how we ended up with a food system that is compromising our future health and prosperity, and how we can urgently reverse course. To kick off this session today, please welcome Grania Maloney, Senior Advisor on Early Childhood Nutrition at UNICEF, where she leads the agency's work on young children's diets. Grania, the floor is yours to open the session.
Thank you very much, Lucy. Good morning, good afternoon, good evening, colleagues joining us across the globe today. On behalf of UNICEF and the World Health Organization, I would like to thank you all for joining our discussion on getting food systems right from the start, where we look into some of the ways in which today's food system is failing young children and ask, what can we collectively do about it? Now, as you all know, the reason we are convening today is that we have a very important opportunity in front of us, the UN Food Systems Summit, which will take place later this year. The summit is a vital opportunity to champion children's nutrition at the highest level and to identify new solutions and strategies that will deliver progress towards the Sustainable Development Goals. Children are the future, and children must be central to our vision for a healthier, more sustainable food systems. With globally less than half of infants under 6 months exclusively breastfed, and 2 in 3 children aged 6 to 23 months not even being fed the minimum diverse diet needed to grow healthy, there are multiple determinants and drivers of breastfeeding and complementary feeding practices. Many of the drivers of poor diets of infant and young children are linked to the food system, yet for some reason, these issues have not been picked up widely on as part of the Food System Summit discourse so far. Food flavors, taste preferences, and dietary habits are shaped early in life with consequences for dietary patterns, food choices, culture, and social norms that last across the life course. Infant feeding practices also impact on the risk of overweight and obesity and non-communicable diseases later in life. Therefore, if we do not get it right from the start, we're fighting a losing battle. Today, the world faces a toxic combination of inequalities, poverty, conflict, climate change, COVID-19, and ever-present food crisis and malnutrition, all of which threaten further progress on nutrition. So to prevent this, we need to overhaul our approach to food systems, from the decisions about what food is produced to how it's processed, packaged, and promoted to ensure more positive impact on children's nutrition. Too often, food systems will profit over purpose. This place the most nutritious food out of the reach for many households. Families are forced to turn to heavily marketed, unhealthy alternatives. They may be cheaper and more available, but they also lead to poor nutritional outcomes, threatening children's development growth, and in the worst cases, survival itself. Every child has the right to good nutrition. For the sake of our children and our planet, we need to turn this around. We call on you all to help us shape better food systems in every country, and let us together find new ways to deliver good nutrition and a healthier planet for every country, every community, and every child. So to deliberate on these concerns, we have brought together an excellent set of speakers for you today, who will discuss how food systems can improve the nutritional quality of commercial complementary food, infants and young children's food environments, and their dietary practices. We have allocated plenty of time for discussion, and we're looking forward to your ideas and insights. So I'm now delighted to introduce our moderator to take us through the next session. Lucy Martinez Sullivan is the founding director of the founding executive director of Feed the Truth, a new organization dedicated to advancing greater transparency in the food system and holding the food industry accountable for their harms from farm to fork. Previously, Lucy founded and served as the executive director of 1000 Days. Lucy has served on numerous advisory boards, including the Global Nutrition Report. So over to you, Lucy, to moderate us through this session. Thank you.
Thank you, Grania, for the warm welcome and for your terrific introduction to this session. I'm thrilled to be moderating this talk today. When I founded 1000 Days about a decade ago, there was little awareness of the critical role that food and nutrition played in the early years of a child's life. And since then, and thanks to the work of many of you, the world has made great strides in understanding the foundational importance of early nutrition as an investment in both individual and societal health and in our future prosperity. But we still have a ways to go, as current conversations around food systems often neglect or minimize the critical and unique role that first foods play in shaping long-term outcomes for both people and planet. In many ways, the first food systems we encounter as human beings is the most important one. It sets the trajectory for the development of our brains, our immunity, our lifelong well-being, and our food preferences. And in the food system that, the first food system that nature designed, breastfeeding and human milk is a biological norm for the first months and years of our lives. In the food system that corporations have designed, the one that has taken hold almost everywhere in the world, a child's first foods are increasingly made up of industrially produced substitutes for human milk and ultra-processed foods that are profit-rich but nutrient-poor. This has devastating consequences for our future health and that of our planet, as you'll soon hear from our presenters. Understanding how we went from a first food system that is, by design, healthy and sustainable to one that fuels obesity, nutritional deficiencies, and environmental degradation is a critical first step in food system transformation. While demographic and cultural changes over the last several decades have created customers for breast milk substitutes and commercially produced complementary foods, the vast sums of money that the food and formula industry has poured into aggressive marketing and political influence strategies have created a multi-billion-dollar market in ultra-processed first foods. Giant corporations like Nestle and Abbott compete fiercely to grow their market share of first foods, which ultimately means fewer babies breastfeeding and fewer children getting the strongest start to life. As a former chief executive of one of the largest formula companies admitted on a call with investors a few years back, their profits rise when breastfeeding rates declines. And for the food and formula industry, protecting profits and maintaining the status quo of an unhealthy, unsustainable first food system means fighting off regulation. It means lobbying and using a network of trade association and front groups to oppose policy solutions that protect health, like marketing restrictions on breast milk substitutes and on unhealthy foods consumed by babies and young children. Make no mistake, there can be no food system transformation without safeguarding public health policy spaces from undue corporate influence. It's why I'm helping to start Feed the Truth, a new accountability organization that works to challenge food corporations' practices that harm health and put the power over food systems back in the hands of people. And it's why I'm excited to be leading this conversation with our presenters today and to hear from all of you. We'll have about half an hour at the end of the presentation for your questions. You'll note that in the Zoom, the chat function is disabled, but you do have access to the Q&A function on Zoom. So please put your questions into the Q&A box as they occur to you throughout the presentation. We'll be collating them and try to cover as many of your questions as possible. One quick housekeeping note, the biographies of all of our speakers are available on the WHO landing page where you registered. So in the interest of time, I won't be reading out the bios for each of the presenters. So now we are going to go ahead and kick it off. I'm going to introduce Phil Baker, who is our first presenter. Phil Baker is a research fellow at Deakin University and a member of the Institute for Physical Activity and Nutrition. His work on first food systems help to explain global changes in infant and young child feeding practices, and in particular, the rise in commercial milk formulas and other ultra-processed foods for children. Over to you, Phil, to tell us about the first food system.
Thank you so much, Lucy, and good evening, everybody, or good morning, wherever in the world you are, from a very cold and stormy Melbourne. It's an absolute pleasure to talk tonight on this topic that I'm very passionate about, first food systems, and especially very passionate about protecting, promoting, and supporting breastfeeding around the world as the best start that children can get in life. So thank you for coming and for listening to my talk today. Next slide, please. Okay, food systems are now high on the world's agenda. Since 2016, at least 50 major international reports have been published on the topic of healthy and sustainable food systems. Although these reports differ in their recommendations, all agree on 2 points. First, that today's food systems are contributing to several intersecting health and environmental crises. And second, that transformative and some even say radical food systems change is urgently needed. Major global policy initiatives are underway. Among them, the United Nations Food Systems Summit, which aims to transform how the world produces and consumes food, to be held later this year in Rome. Next slide, please. Next slide, thank you. A sustainable food system is one that ensures food security and nutrition for all in such a way that the economic, social, and environmental bases to generate food security and nutrition of future generations are not compromised. And here I emphasize the term future generations because it is for today's children and for those unborn children still to come, for whom this work on sustainable food systems is ultimately for. Yet surprisingly, most of the international reports I mentioned earlier do not mention breastfeeding at all. And of those that do, most do so only briefly. So how can we think about infant and young child feeding in terms of food systems transformation? How can we integrate thinking and action on breastfeeding within the food systems transformation agenda? Arguably, two important conceptual frameworks are the Enabling Environments for Breastfeeding framework from the 2016 Lancet Breastfeeding series and the Innocenti framework on food systems for children and adolescents. These frameworks are important because they help us to think about the determinants of infant and young child feeding in terms of food systems and offer helpful terminology. Importantly, too often infant and young child feeding is framed as a matter of maternal choice and responsibility alone, that it's up to mothers to breastfeed, or formula feeding is a failure, which is a deeply unhelpful perspective and way of framing this problem. However, these frameworks clearly show how many factors beyond the control of mothers can powerfully influence feeding decisions. From this perspective, it is the responsibility of all of us, governments, civil society groups, healthcare professionals, workplaces and employers, the baby food industry, and us as individuals to support, promote, and protect breastfeeding. Next slide, please. Drawing from these and other food systems frameworks, we developed a First Food Systems framework. We define first food systems as the food systems that provision foods for infants and young children and that structure feeding practices at the population level. We've used this framework to guide our recent papers, which consider these main 6 components of first food systems. This framework can help to guide our thinking on several key questions. For example, why did world breastfeeding rates plummet in the mid to late 20th century, but more so in some countries than in others? What's driving the current global rise in breast milk substitution, especially in East and Southeast Asia? And what explains the resurgence in breastfeeding we're now observing in some countries, but not in others? As many of us now know, the answers to these first 2 questions include rising incomes, urbanization, the medicalization of pregnancy and birthing, the globalization of the baby food industry and its aggressive marketing practices, and the failure of government policies to protect, promote, and support breastfeeding. Next slide, please. This is a key question. What are first foods? First foods are the foods consumed in the first 36 months following birth, although arguably this could be extended to include foods from conception onwards. There are 2 major categories. The first are what I call biological and normative foods. And these are basically what human populations have always fed their children. This, of course, includes breast milk from the mother or from another lactating woman or from a donor or other supplier. It also includes complementary foods that are typically home-prepared family foods fed alongside continued breastfeeding. The second major category, in contrast, are commercial and novel foods. These are foods that are novel because babies have only been consuming these foods much more recently in human history. Breast milk substitutes, for example, were invented in the 1850s and 60s and have only been consumed by human populations since that time. These are also commercial foods that are marketed commercially for consumption between the ages of 0 to 36 months. The novel concept therefore also includes ultra-processed foods, which are relatively new additions to human diets, only in the past 100 years or so. Next slide, please. Any talk on first food systems must include at its center the mother-child breastfeeding diet. The diet is a highly sustainable food system in and of itself, and arguably it is the world's most remarkable food system. It represents an on-demand global food production system and is the shortest food supply chain on Earth, delivering with unparalleled food safety. It delivers optimal and personalized nutrition and immunological factors, with its composition changing from feed to feed, from day to day, responding to the child's evolving developmental needs. It is a crucial food source in and of itself, especially in low and middle income countries. Breast milk is literally packaged with love, given that breastfeeding fosters mother-child bonding and reduces stress for both. Importantly, it is also a highly sustainable supply chain, requiring only small amounts of additional food for the mother. Yet despite these remarkable benefits, less than half of babies born today meet the WHO recommendation of initiating breastfeeding within the first hour of life, breastfeeding exclusively for the first 6 months, and continuing to breastfeed for up to 2 years of age or beyond. Next slide, please. In contrast, global markets for commercial milk formulas are absolutely booming. Commercial milk formulas were invented in the 1860s to serve a legitimate social need, to feed the very small proportion of infants unable to breastfeed. In our recent work, we show how these products have since become a mass-produced consumer good. And arguably, this represents the displacement of the mother-child breastfeeding diet as the biological first food supply chain with commercial supply chains. We question whether this transition to higher formula diets is unprecedented in human history. The scale of change underway must be considered, given that this rising consumption is occurring in highly populated middle-income countries. Next slide, please. We find very wide variation in levels of commercial milk formula consumption across regions and countries at similar levels of economic and social development. This indicates that the transition to higher formula diets is not at all an inevitable consequence of economic development, and rather it reflects differences in how first food systems structure feeding practices across entire populations. On the right here, we have a figure from an excellent paper led by colleagues in Brazil. It shows that in low and middle income countries, commercial milk formula consumption strongly and negatively associates with continued breastfeeding at 1 year of age, supporting the position that commercial milk formulas displace breastfeeding. Next slide, please. In our recent work, we use the term hyperglobalization to describe how country-level production and trade in commercial milk formulas has massively escalated between 2005, which you can see on the left, and 2017 on the right. As you can see, many of these largest arrows, which represent trade in commercial milk formulas, point from high-income dairy-producing nations to China and Southeast Asia, where the largest infant and young child feeding transition has occurred. Next slide, please. So what are the implications of this fundamental shift in infant and young child feeding practices for sustainable food systems? Well, the health implications are well known and documented. Since at least the early 1900s, baby bottle syndrome, or a cycle of diarrhea, dehydration, and malnutrition from artificial feeding in less than ideal conditions has been reported in many countries. We also know that not breastfeeding increases the child's risk of infection, of all-cause mortality, and obesity and type 2 diabetes in later life. And for mothers, the risk of certain cancers and type 2 diabetes. There are also significant implications for food security, sustainable economic development, and of course the environment, which I know others will also touch on later as well. I would like to make a key point here. WHO has long recognized that follow-up formulas, including toddler milks, are unnecessary and unsuitable as breast milk substitutes. Therefore, the huge rise in the production of these products wastes valuable resources and is ultimately an unsustainable commercial practice. Next slide, please. First food environments are the contexts in which mothers and caregivers make feeding decisions. Hospital maternity wards, birthing centres, and other clinical settings can support or seriously undermine and too often break the mother-child breastfeeding dyad. Multiple studies report breastfeeding knowledge and skills deficits among healthcare professionals, limited consideration for breastfeeding in medical curricula, and apathy towards breastfeeding in hospital settings. This is something that baby food companies have capitalized on by providing health professionals with medical education directly. Health systems are also a key marketing channel for the companies. Formula is marketed directly to healthcare professionals, including donations of free or low-cost samples, gifts, and the sponsorship of pediatric associations, as well as other healthcare professional bodies. The Baby Friendly Hospitals Initiative was established by WHO and UNICEF to promote, protect, and support breastfeeding, requiring certain conditions are met before certification, including implementation of the 10 steps to successful breastfeeding. This has had a significant positive effect on breastfeeding rates, yet worldwide, just 10% of infants are born in baby-friendly hospitals. This in and of itself, getting health systems to support the mother-child breastfeeding dyad represents a major potential game-changing intervention for transforming first food systems if we can adequately fund and implement these kinds of initiatives. Next slide, please. In the context of absent or ineffective maternity protection and breastfeeding supported workplaces, the choice to formula feed or breastfeed is not a true choice. Formula is often the only choice if the alternative is the loss of employment and income for the mother. The vast majority of mothers worldwide lack basic maternity protection, especially in countries with large informal sectors. Another major challenge concerns how we think about and value mothers' work, including the immense value they provide society by breastfeeding. National accounting systems and economic output measures are strongly biased against breastfeeding when they include the value of milk formula sales to gross domestic product, but the value of breastfeeding is not counted whatsoever, and hence it remains invisible to economic decision makers. Next slide, please. The aggressive marketing and promotion of breast milk substitutes is a dominant feature of fast food environments. Marketing shifts social norms and attitudes about what infant and child feeding practices are considered normal, acceptable, and socially desirable. And this at least partly explains how and why societies shift from supportive breastfeeding cultures to those conducive to formula feeding. In our papers, we identify these 3 core marketing strategies used by the baby food industry. This year marks the 40th anniversary of the International Code of Marketing of Breast Milk Substitutes. Although about 70% of countries have adopted some provisions of the code international laws, just 13% are fully aligned with the code, and 30% of countries have no provisions or no protections against this marketing whatsoever. A game-changing solution for first food systems would therefore be full and comprehensive worldwide implementation of the code into national laws, inclusive of all products for ages 0 to 36 months. Next slide, please. Finally, we must consider who has power to influence first food systems. In our recent work, this is what we have been referring to as the political economy of first food systems. And I don't have anywhere near enough time to explain this huge topic, but here is a figure from our recent paper. This shows the network of corporate-funded lobby groups that the baby food industry coordinates globally to influence policy and regulatory environments, especially in relation to blocking regulations of milk formula marketing. Arguably, it is this network that represents a major impediment to worldwide implementation of the code, and taking action to firewall, to block the participation of these groups from national and international policy processes could also be a game-changing action for first food systems. Next slide, please. The power of evidence-based advocacy to generate the necessary political will to enact legislation and policies to protect, promote, and support breastfeeding is also crucial. Massively increasing and investing, financing, and supporting leadership, breastfeeding coalitions, and advocacy is in and of itself an important game-changing action for first food systems. This should be considered an essential nutrition action and one that can really make a difference in the world for our children. Next slide, please. Mothers are in themselves an incredible force for transformative first food systems change, and I would argue sustainable development more broadly. The pictures on the left are from the Philippines, which I believe currently holds the Guinness World Record for the largest mass breastfeeding event. And it has among the world's most active civil society for breastfeeding and resisting industry influence. The top right is from Brazil, where the World Breastfeeding Congress was held in 2019. And the bottom right is from Australia, where our Senator Larissa Waters breastfed her child in Parliament. Strengthening peer-to-peer mother support groups and networks is also a potentially game-changing action for first food systems. The resurgence of breastfeeding now underway in several countries, including Australia and the United States, is at least to a significant extent a reflection of mothers mobilizing and taking collective action for their rights and the rights of their children. So please let us stand with them and for them. Thank you very much.
Thank you so much, Phil. That was a tour de force for sure. Something I was really struck by in your presentation was when you said higher formula diets are unprecedented in human history, and that massive transition from breastfeeding being the norm to increasingly the majority of babies in many countries, and certainly the trend is throughout the world, being formula fed, is something that is of concern. And I do like the point that you made about that this transition is not inevitable. We still have time to reverse that. And with that, we're going to hear from another presenter with some insights to offer on that front. I want to introduce Leslie Oot. She is the Associate Director for Alive and Thrive, a program of FHI 360. And Leslie will talk about the breastfeeding as a first food system in and of itself, and focus attention on marketing of breast milk substitutes. Leslie, over to you.
Thanks very much, Lucy. Excited to be here and be involved in such an important discussion. I'd like to expand on Phil's presentation to discuss the importance of protecting and supporting breastfeeding within the food system. Next slide. Current food system frameworks, such as the framework shown here, fail to adequately address a critical part of the food system, breast milk, which, as Phil explained, is the first human food and also the critical factors within the food system that impact breastfeeding. As Phil mentioned, breastfeeding and other infant feeding behaviors are often portrayed as individual behaviors, a matter of free parental choice and the responsibility of parents alone. However, feeding decisions are not made in a vacuum, and too often are influenced by factors that do not have the best interest of the baby and family at heart. Therefore, it's critical that as we have these discussions about the food system, we understand how key determinants within that system influence early feeding decisions and ultimately health and nutrition outcomes. Next slide. I am a co-author of a new brief that identified 3 influencers within the health system that dramatically shape what and how an infant is fed, but are currently missing from existing food system discussions. These are the impact of the commercial milk formula or CMF industry on breastfeeding, the impact of maternity protection policies on infant and young child feeding behaviors, and the impact of the CMF industry on the environment and climate change. Although all 3 influences are important, today I'll mostly focus on the impact of the CMF industry on on the food system and breastfeeding itself. And when I say the CMF industry, that's also can be termed as BMS, or the breast milk substitutes industry. So it can be used interchangeably. I know Phil discussed, sorry, next slide. I know Phil discussed this briefly, but commercial milk formulas are an ultra-processed food source and should be identified by consumers, companies, and governments as such. They are foods marketed or otherwise which are represented as a partial or total replacement for breast milk, including any milks marketed for children ages 0 to 36 months. There are several categories that fall under CMF, including standard infant formulas, follow-up formulas, growing up or toddler milks, milks for older toddlers, and then specialized formulas, such as for kids with allergies and other conditions. These categories are one of the tactics used by the CMF industry to sell their products, which I'll discuss later on. Next slide. So why do we care about breastfeeding and its role in the food system? Although I know Phil discussed this a little already, I wanted to reiterate and discuss a few key points. First off, breast milk is the first optimal food. It provides infants its first vaccine, but also the nutrients and water they need to survive and thrive. Breast milk even evolves and changes over time, fitting the needs of the baby as it grows, something formula simply cannot do. Substantial and well-known global evidence exists regarding the benefits of breastfeeding for infant health and survival, including the reductions in obesity and chronic illness. However, the benefits of breastfeeding go well beyond health. Breastfeeding can improve cognitive development among infants, which translates at a national level to higher intelligence levels and greater economic productivity. Basically, supporting breastfeeding is one of the best investments governments can make, as every dollar invested is estimated to result in a $35 economic return. Breastfeeding is also a best bet for the private sector. Having breastfeeding supportive workplaces, which includes paid parental leave, paid lactation breaks, and access to private and clean spaces for expressing breast milk, helps to attract and retain high-quality staff, improves the company's brand and image, and often earnings, and reduces healthcare costs for companies. Studies from the United States demonstrate that workplace breastfeeding policies save an average of $3 for every $1 invested due to reduced employee turnover, increased employee satisfaction, and reduced absences due to illness. Breastfeeding is also more environmentally friendly than the alternative, which uses resources to produce, transport, and market. A 2016 study found that emissions created by producing CMF from just 6 Asian Pacific countries generated 2.9 million tons of carbon dioxide, which was equivalent to driving more than 6 billion miles by car. Conservative estimates indicate that each kilogram of milk formula produced generates 4 kilograms of greenhouse gases during production. Furthermore, CMF products are often packaged in non-recyclable or reusable materials. And research shows that feeding 1 million babies with formula for 2 years requires, on average, almost 150 million cans of formula. As a breastfeeding mother myself, I can say that breastfeeding is definitely not free. It has time and opportunity costs, but breast milk production itself only requires the mother consume an additional 500 calories a day to account for the extra energy expended in producing milk. Next slide. To provide a little more context as to how the CMF industry can have such a big influence on breastfeeding behaviors, it's important to share a little bit about what we know influences a mother's decision to breastfeed. First and foremost, a mother rarely makes the decision to breastfeed alone. As shown in this conceptual framework from the 2016 Lancet series, a mother's decision to breastfeed is influenced by determinants at the structural, settings, and individual levels. At the structural level, breastfeeding decisions are influenced by social norms and customs, often influenced by the media, advertising, and marketing, but also national policies and legislation. At the settings level, the health system and health providers influence infant feeding decisions by providing advice and support to mothers to breastfeed, but they also can deter and harm breastfeeding practices by promoting CMF, offering free samples, and providing unclear guidance for mothers, all of which are a marketing tactic used by the CMF industry. At the individual level, a mother's personal attributes, such as her age and education level, can also influence her breastfeeding choices. As I'll discuss in the next few slides, the CMF industry seeks to influence infant feeding decisions across all 3 levels, changing social norms, influencing political and regulatory environments, impacting the health system, and changing individuals' perceptions and beliefs. Next slide. So how does the CMF industry sell their products? I know Phil mentioned this a little bit, and I won't have time to go into all the ways listed on this slide. But as you can see, the CMF industry uses diverse and evolving tactics to influence consumer behaviors and the food environment. This includes traditional media through advertising through magazines, radio, TV, and in stores, using false information, unsubstantiated health claims, and preying on parents' emotions to sell their products. They also use product innovation and cross-promotion. As I mentioned earlier, they sell a large range of products to create brand recognition and appeal to segmented audiences. For example, promoting special milks and more expensive formulas for conditions such as sensitive tummies, poor sleepers, and parents seeking to improve their child's immunity or cognition. And also a recent tactic used by CMF industry is social media and digital platforms, which is used not only to post advertisements, but also used through more nefarious techniques, by hosting moms or parenting groups to sell their products, and even using these mothers and caregivers as mombassadors to sell their products for them. They also prey upon crises and emergencies, such as the recent COVID-19 pandemic, utilizing fear to sell their products. As shown in the figure on the slide, one CMF company, Colos Baby in Vietnam, even used the WHO Director General's picture without his consent to evoke fear of COVID, and the solution to that fear being a CMF which boosts the immune system. Evidence shows that these tactics work. A recent study in Cambodia found that 86% of mothers surveyed in Phnom Penh had seen or heard a commercial promotion for BMS. Furthermore, a recent survey in the US found that 52% of caregivers agreed with the statement that infant formula can be better for babies' digestion and brain development than breast milk. And 62% felt that it could provide nutrition not present in breast milk. So why do we care about the CMF industry and their practices? As Phil discussed, the CMF industry is massive and its growth is almost unfathomable. Sorry, next slide. As shown in this graph, global formula sales have increased from 1.5 billion in 1978 to 56 billion in 2019, and is expected to reach around 119 billion by 2025. This growth represents a 36-fold increase over a 40-year period and a doubling since 2005. Formula companies now make more formula than children to consume it. And it's hard to imagine that an industry this large doesn't have significant influence on global markets, global diets, and ultimately the health and nutrition outcomes of babies and families around the world. So why does this matter? While there are some children that may need formula, such as orphans, formula is not necessary for most infants. Furthermore, as Phil mentioned, formula can be harmful, as not only does it displace breast milk, but when promoted in context with poor water and sanitation, its use can be deadly. Next slide. This is all despite the existence of the International Code of Marketing of Breast Milk Substitutes and the subsequent relevant World Health Assembly resolutions, collectively known as the Code, which prohibits the promotion of breast milk substitutes, bottles, and teats, and seeks to ensure parents have clear and factual information on how to best feed their infants. However, despite the existence of the code since 1981 and a lot of progress made over those past 40 years, widespread violations still exist. However, when fully aligned and carefully monitored, the code does work. As shown in the slide, in 2008, China and India were identified by Euromonitor as the top countries to help drive future sales of baby suits. However, India, which has strong CMF marketing regulations and enforcement mechanisms, saw limited CMF sales growth, while China, which has weaker legislation and enforcement, saw CMF sales grow wildly between 2008 and 2018. Next slide. So what can we do? The following recommendations propose how stakeholders at the UN World Food Summit and beyond can support the first food system within their action tracks. Within Action Track 1, which promotes ensuring access to safe and nutritious foods for all, governments, investors, and the private sector need to ensure that women have access to quality breastfeeding counseling and services before, during, and after childbirth. Governments and the private sector also need to provide breastfeeding-friendly workplaces and ensure adequate paid parental leave is provided. Governments, donors, and implementers need to work with communities to develop solutions to address the lack of maternity protections, especially for mothers working in the informal sector. Next slide. Within Action Track 2, which focuses on a shift to sustainable consumption patterns, governments need to fully adopt and enforce the code. Stakeholders, including consumers, investors, CSOs, and the UN, need to demand CMF companies publicly commit to full compliance with the code. Governments and stakeholders, including investors, CSOs, and the UN, need to increase public awareness and understanding of the code and its role in ensuring that children have access to safe and optimal first foods. And communication should focus on promoting breastfeeding as a social norm, denormalizing the consumption of CMFs, and calling out CMF companies and media platforms when they violate the code. And finally, stakeholders need to raise awareness around the impact of CMF production and consumption on food security, climate change, and the environment, and conduct research on those impacts. In conclusion, the massive and fast-growing CMF industry has a huge impact on food systems, undermining breastfeeding and parents' abilities to make the best choices for their children. Support from the food system to help raise awareness, advocate for, and help implement and enforce the code is critical to reining in the CMF industry's influence over consumer behavior and the food environment. Next slide. Lastly, I just want to close by saying thank you to Karen Lapping and Francis Mason, who contributed to the development of these slides, and to share information on the Live and Thrive's new webpage dedicated to the code. Thanks very much. Over to you, Lucy.
Thank you so much, Leslie. Really terrific presentation, and highly encourage everybody to check out that website and the webpage dedicated to the code. It's really excellent. Leslie was really struck by the fact that there is more formula than children to consume the product. That's quite interesting, and thank you for touching on the environmental impacts of milk formulas, and hopefully we'll pick up on that thread in the Q&A. Next, we have Joe Jewell. Joe works with UNICEF's nutrition section on child overweight and obesity prevention and food systems. He previously worked at the WHO Regional Office for Europe. And Joe will discuss issues around complementary foods, how they're marketed, particularly focusing on the sugar and salt content of commercial complementary foods. Joe, over to you.
Thank you very much, Lucy, and thank you very much to WHO for jointly convening this meeting today with UNICEF and inviting me to present to the audience and really to share UNICEF's view as to why the Food Systems Summit must address the specific nutritional needs of young children, and why transforming the first food systems, as we're discussing today and previous speakers have touched on so eloquently, must be a central priority in the summit outcomes. I'd first like to thank colleagues from UNICEF who have helped me prepare these slides. Importantly, acknowledge the work of Ashley McGarg, who plays a leading role in coordinating much of the work on young child nutrition, and also acknowledge the support and input from my former colleagues at WHO Regional Office, whose work I'm also including in this presentation. Next slide, please. So I just really want to briefly touch upon, how UNICEF looks at the situation with regards to child malnutrition today. I don't want to go into too much depth because some of the speakers have already touched on this, but I mean, we have made historic progress and we've achieved a lot in maternal and child nutrition. Since 2000, the prevalence of stunting has declined by 1/3, and importantly, the number of stunted children is 55 million lower than in 2000. With specific regard to the topics we're discussing today, the number of children who are exclusively breastfed is 80 million higher than in 2000. Therefore, I think we've collectively as a community demonstrated that positive change for nutrition is possible and is happening at scale, in large part due to improvements in the food system, or changes that we can make through the food system. However, there is still much to do, and of course, COVID-19 threatens to further undermine our progress, and some of the transformations in the food system that Phil and Leslie have already alluded to are threatening to really undermine and actually change the direction of child nutrition. So, I mean, some of the key figures, you know, at least 1 in 3 children under 5 are stunted, wasted, or overweight, reflecting this triple burden of malnutrition. At least 1 in 2 children suffer from micronutrient deficiency still, and at least 2 in 3 children are not fed the minimum diverse diet they need to grow, develop, and learn to their full potential. Next slide. And as our previous speakers have spoken so eloquently about, essentially there are new forces changing the face of malnutrition globally today, which is causing us to progress to stall and in fact reverse in some instances. Globalization and urbanization are changing the way children are fed. Inequities and climate change are having a negative impact on access and affordability to nutritious foods. And of course, humanitarian crises and health epidemics across the world are further putting pressure on systems and also families who are doing their best to feed their children well. The result is this triple burden of malnutrition, which unfortunately represents persistent undernutrition, while the number of children who are overweight continues to increase in almost all regions of the world. Next slide, please. So UNICEF's Nutrition Strategy 2020 to 2030 really tries to address this triple burden of malnutrition that we're facing and has a goal to protect and promote diets, services, and practices that support optimal nutrition for all children. We want to do this by improving the availability, affordability, access, and desirability of nutritious foods. We want to ensure that children have access to quality nutrition services delivered through multiple systems, and that children benefit from optimal dietary practices. Next slide, please. Click on one more. A priority for UNICEF is improving the nutritional quality of young children's diets, which we believe can be achieved by addressing these underlying determinants of poor diets. Reflecting the nutrition strategy, the key determinants are adequate foods, adequate services, and adequate practices. A review of the evidence has shown, however, that while we're implementing policies and programs to improve young children's diets, they're not always designed or implemented effectively. They've been too much focused on improving complementary feeding practices, and not enough focus has been given to improving the quality of complementary foods or access to the essential services for young children. And also our approaches have been siloed, scattered, and also not grounded in sound situation analysis. So we've asked ourselves at UNICEF what is required from the policies and programs to be more effective for improving young child diets. Next. UNICEF believes that strategic actions are needed across 4 important systems: the food system, which we're discussing today, health, water and sanitation, and also social protection systems, and that these systems all need to work together in order to deliver positive impact for children's diets. Next slide. To guide countries in designing the effective and comprehensive approaches, UNICEF has proposed an action framework which is grounded in situation analysis and looks at what are the potential actions across these 4 systems, working through policy, service delivery, community and household actions. Next slide, please. So obviously our focus of discussion today is working with the food system and what food systems can do to deliver better nutrition for young children's diets, what we're calling, I guess, first food systems today. So we're working again through the food system to improve the quality of children's diets, food environments, and food practices. Examples of how UNICEF advocates and supports improving the quality of complementary food includes through national dietary guidelines and standards on the composition of complementary foods, also including fortification, particularly of staples such as cereal, flour, rice, and other local foods, especially where micronutrient deficiencies or nutrient poor diets are particularly widespread. And of course, home-based fortification of children's food in setting where nutrient deficiencies or anemia are particularly present. With regards to food environments for young children, we also advocate for public sector policies and programs that facilitate access to healthy food, such as targeted food subsidies, but also importantly, as previous speakers have alluded to, and I will go into more detail now, policies that protect young children from the harmful impacts of food marketing practices. This includes the full and effective implementation of the code, as so lovelily put by Leslie, but also enforcement and implementation of WHO 69.9, and of course the WHO set of recommendations on marketing of foods and non-alcoholic beverages to children, which we know is also a very relevant and important set of recommendations for young children, and I believe the following speaker, Alyssa, will talk about that. And finally, we do advocate and support complementary feeding practices and support to caregivers, including through counselling and communication. And I think there are important links between that and how the sort of policies that we put in place to improve food environments can be complemented and supported by counselling and feeding practices support. Next slide, please. So the WHO 69.9, the WHO guidance on ending the inappropriate promotion of foods for infant young children has been absolutely critical in terms of looking at this issue of the nutritional quality of young children's diets and also making sure that inappropriate promotion isn't undermining optimal nutrition practices. The purpose of the WHO 69.9 and the guidance is really to protect breastfeeding, of course, but also to prevent overweight and obesity and the risk of diet-related and non-communicable diseases, which we know start early, to promote a healthy diet and ensure that there is clear and accurate information on feeding. Next slide, please. There are many recommendations, many important recommendations, and I urge everybody who is not familiar with the WHO 69.9 to read it in depth, because it's absolutely critical for this agenda. But there are a number of important recommendations that I just wanted to extract here. Recommendation 3 is important around the standards for composition, safety, quality, and nutrient levels. And I think this really recognizes that foods that are targeted at a specific age group need to be of very high quality and adhere to the highest nutritional composition standards. And in order to do that, we need nutrient profile models to be developed and utilized, which can design, guide the decisions on which foods are appropriate or inappropriate for this age group. Secondly, linking it with recommendation 4, which is about the messages and the way in which the companies communicate about these products. And I think the 2 recommendations link the composition, labeling, and promotion aspects, which are absolutely critical here. Next slide. And why are we interested in this specific age group? And I think Phil and Leslie have both talked to this, but just very briefly to show that globally there is a huge increase in commercial complementary food sales and consumption, and so we need to be aware of this and looking at it specifically from a policy perspective. So I just drew out two examples, one from the UK, which was a scoping review done by Public Health England that looked mainly at the context in the UK, but also internationally, and found a very high proportion of infants and young children were consuming commercial products. And then just to illustrate that this is not just a high income country issue, I drew on a paper by colleagues from Helen Keller International from Indonesia, I believe, which showed a similarly high proportion of infants and young children consuming these products. And whilst the products may not be identical, I think there's certainly a trend, as Phil was mentioning, towards greater penetration of these products across the world. And so we need to consider what is these trends and how do we respond through policy if the impact is harmful. Next slide. So what are some of the issues with commercial complementary foods? And I will be, before we share the slides, which I think we'll be doing afterwards, I'll add some references to this slide. But really there are studies from around the world, from Latin America, from North America, from Europe, and increasingly from Asia and Sub-Saharan Africa even, which are showing that the commercial complementary foods have a number of sort of consistent issues with them. Many of the products are marketed from 4 months, which is obviously very problematic in terms of undermining exclusive breastfeeding recommendations. Purees often are a very common product that we find. Fruit purees predominate, and they have a very high free sugar content and total sugar content. But of course, much of the sugar content is free sugar because it's so highly pureed. and therefore the sugar is liberated from the cell of the food. They often contain added sugars or sweetening agencies. So, of course, fruit is naturally sweet, but there are also added sugars in there. And overall, the foods are predominantly sweet. So even products that are labeled as a savory meal, for example, a chicken dish, will have a very high sugar content and very high ingredient list content from sweet foods. And we're also seeing this worrying emergence of products in pouches, which is encouraging children to suck from the pouch rather than eat food and learn to eat together with the family. And of course, there's all the messaging around it. And finally, snack and confectionery products, which are widely available, and they're sort of inconsistent even with dietary recommendations for the general population, let alone a vulnerable population like young children. Next slide. So we did some work together when I was at WHO Europe, looking at what is the situation in countries across the region. And this study focused primarily on Austria, Bulgaria, Hungary, and Israel. But I'm aware from colleagues in WHO Europe that further work has been done. Essentially, a huge proportion of the products were marketed as being suitable for infants under the age of 6 months. Very problematic. Very high sugar content, and more than 4 in 10 products had over 40% of total energy from sugars. Widespread use of claims and statements regarding the nutrition and health components, and a worrying lack of information on many labels as well. Next slide. So based on this work, we actually did an effort to basically translate, I guess, the WHO guidance, WHO 69.9 and the guidance into something practical, which is, in the form of a nutrient profile model. But the nutrient profile model addresses both the composition, but also packaging, labeling, and naming issues that we've identified with the products. And I try not to go through this whole list because I know that we are potentially running short of time. But essentially, there are a number of elements proposed here that should be covered in the nutrient profile model, and I would recommend that you go and have a look at it. And I should also show that it's now being piloted and looked at by colleagues in other regions, including UNICEF in Asia, who's working with a consortium of organizations to see how this model would be applied to a different context, see if there are any adaptations needed, potentially micronutrient elements, for example. And also, I know that there are conversations that have been raised by others around level of processing and whether that's an important consideration to include in such a nutrient profile model. So I'll stop here and say thank you. My next slide is just a happy slide, but thanks very much for the time today.
Thank you, Joe. And I do love this slide because it reminds us why we're here, why we're doing this work. I was struck by the issues that you highlighted in commercially produced complementary foods. There's a lot that needs to be addressed and tackled. And thank you for lifting up the critical role that policy plays. Our last presenter is Alyssa Priest. And she is the Senior Research Advisor for Helen Keller International and Helen Keller International's Assessment and Research on Child Feeding Project, better known as ARCH. Alyssa will talk about the consumption of junk foods for infants and young children, and this presentation is terrific. Alyssa, over to you, and then we're going to open it up after Alyssa's presentation to the Q&A.
Many thanks for that introduction, and good morning, good afternoon, good evening to all the attendees joining from various time zones across the globe. I'll be spending the next 10 to 12 minutes discussing how we can protect young child diets in the face of unhealthy food environments. Next slide, please. So as previous presenters have noted, there's a commercial reality of infant and young child feeding. We know that children under 36 months of age are consuming breast milk substitutes, they're consuming commercially produced complementary foods, but there's a third category of foods that are commercially produced and packaged that young children are consuming. And these are junk foods, snack foods, ultra-processed foods. Next slide, please. And within these foods, within these types of foods, we can see that there is a transition happening depending on where we look to the globe. Consumption of these foods has historically been high in regions such as North America and Latin America, but sales per capita are dropping off. This shows Euromonitor data that was presented in the 2018 Global Nutrition Report. And while sales are reducing in some places, they still remain high. And we can see that sales are growing in emerging economies in regions of Africa and in Asia. Next slide, please. And this is of concern because these packaged unhealthy junk foods tend to be energy dense and nutrient poor. This is a figure also from the 2018 Global Nutrition Report showing data from ATNI's Global Index, where these packaged foods were assessed with the Health Star rating, which is a nutrient profiling model used to assess the nutritional quality of foods. And it found that less than a third of these packaged products met the threshold for what would be considered healthy. If you can do one click, please. This is not just an issue that's been happening in the past, but it's very much a present day issue as well. Some of you might be familiar with a recent headline where Nestle assessed their own products using the same nutrient profiling model and found that almost 2/3 of their products still did not meet this recognized definition of health. Next slide, please. We know from literature that's been coming out over the last decade that the prevalence of consumption of these unhealthy junk foods among young children and infants is high. Within the ARCH project, we've been interested in, well, how much of these foods are actually being consumed during the complementary feeding period. This is a table that was adapted from a systematic review conducted in 2019. And you can see on the far right, the proportion of total energy intake that came from these unhealthy snack foods and junk foods. You can see that these ranged from 13% of all calories consumed among young children under 2, all the way up to 38%, depending on the context and whether it was an urban or rural setting. The median total energy intake was around 20%, or 1/5 of all calories consumed outside of breast milk were coming from these types of unhealthy packaged foods. So we know that a lot of children are consuming these types of foods, but what we're also starting to realize is that they're consuming a lot of these types of foods within their overall diet. Next slide, please. So what does this mean for young child nutrition? We know that from literature among older children, school age adolescents, that this type of consumption and this degree of consumption can result in excessive energy intakes. This can increase the risk of overweight and obesity. But among young children, there's an interest in understanding what type of diet displacement is happening. Again, there's not a lot of literature out there, but a few studies have begun to show that there is potentially displacement happening. In Australia, among 16 to 24-month-olds, it was found that high consumers of unhealthy packaged foods had reduced intakes of several micronutrients. And in a study conducted as part of the ARCH project in Nepal, we found that children at 12 to 23 months of age who were consuming the greatest degree of these products were at greater risk of dietary inadequacy for 8 micronutrients. This included calcium, iron, and zinc. We were then interested in the link between this reduced dietary adequacy and if it actually was translating into any growth outcomes. And what we found was that there was an association where, again, these high consumers of unhealthy snack foods had about, on average, about 0.3 standard deviations lower length for age Z score than their peers who were consuming less of these products. So we're seeing that it's not just an increased risk for overnutrition, but that for young children, particularly in areas where nutrient adequacy is limited in the diets, it can be also a risk for undernutrition. Next slide, please. So why are caregivers turning towards these types of products? Again, a lot of the literature has been looking at drivers of food choice among older children and adolescents, but we're starting to understand what's going on in terms of caregivers' decision-making for young children as well. One factor that comes out highly in a lot of the literature is the convenience factor. People talk about the convenience of not having to cook, not having to prepare food. And this is related to what we see among infants and young children, but there's another element to this. In a study, again, that was conducted in Nepal, but using qualitative methods among caregivers of children under 2, this convenience factor came out prominently. But it was, again, not just the preparation, but also the ease of feeding young children. This could be a very fussy age group to encourage to feed. And we found that these types of products were highly convenient for caregivers. But this relates directly to how palatable these foods are. We know that manufacturers put a lot of research and effort into developing these ultra-processed foods that are highly palatable. They have textures and sweetness that appeal to children and also young children. And so caregivers were reporting that these foods could just be handed to a child and they were readily consumed, rather than a lot of the work that has to go into encouraging a young child to consume other types of foods. We also know that these types of foods are highly affordable. There is a great deal of literature out there that has found that these foods on average are much cheaper than other foods that are more nutritious, such as eggs and fruits. And of course, there's the ubiquitous marketing of these types of foods. Next slide, please. This is a paper that was a comparative study of 4 different contexts in Dakar, Dar es Salaam, Kathmandu, and Phnom Penh. And within the ARCH project, we were asking mothers of children within the complementary feeding period, 6 to 23 months of age, if they have been exposed to any mass media advertising or promotions for different types of commercial foods fed to young children. And we can see, unfortunately, that the promotions for breast milk substitutes were prevalent in many of these settings, as well as for complementary foods, but that across the board, the most prevalent observation of promotions were for these commercial snack food products. Next slide, please. There's also promotion that's happening on labels. So these are 4 products that we found to be highly consumed in Nepal. If you could do 1 click, please. You can see that on each of these packages, there was also the presence of health and nutrient content claims. So these are claims that talk about the benefits for children's intelligence, for their health, and for the micronutrient content of them. Within that qualitative study that I mentioned, we had asked caregivers to rank different types of commercial food products on a spectrum of healthfulness. Generally, packaged commercial junk foods tended towards the unhealthy end, but there were certain food products that they shifted closer to the healthy end of the spectrum. And these were foods that they mentioned had contained milk, or they had images of fruit on them, or they had talked about how they claimed to have certain vitamins and minerals. So these types of claims can lead to a difference in how consumers perceive how healthy they perceive them to be. Next slide, please. So how can we protect infant and young children in the face of this inappropriate marketing? What type of global guidance do we have out there? So 1 click, please. For breast milk substitutes, of course, we have the code. Next click. And for commercial complementary foods, we have WHA 69.9 and WHO's guidance on that. There's also WHO guidance on ending marketing towards children generally. But how do we think about ending this marketing of junk foods, specifically when we're thinking about infants and young children? Next slide, please. Again, a lot of the literature that's out there is really looking at what type of restrictions of marketing have worked for older children and for adolescents. But I think there are a lot of lessons that we can learn from those papers as we think about solutions for this young age group. The first is nutrient profiling, which Joe mentioned in his presentation. So this is a use of algorithms to assess the nutritional quality of products. And this is not just done in isolation. This is often tied to mechanisms such as front of pack warnings. So you can see here the famous example from Chile, which used nutrient profiling to identify foods that were unhealthy based on nutrient content. And those that were too high resulted in these black stop sign warning labels, indicating they were too high in sugar or in sodium. In these cases as well, certain marketing tactics that appeal to children, such as cartoons, were also removed from packaging. These types of front of pack warnings can increase consumer awareness, but there's also an incentive to manufacturers to reformulate because no one wants to carry these type of warning labels on their packages. We've also seen that some countries have used this type of nutrient profiling to identify foods that should have advertising restrictions. So this can mean that these types of products are not allowed to be advertised on television, through social media, or online. And a lot of these examples have been enacted in order to reduce exposure of children to these type of commercials and advertising. But I think it's an interesting question of whether there's also an influence then on caregiver choice, who might also be watching some of these commercials. And of course, there are fiscal policies. So we've seen in various different contexts the enactment of sugar taxes, junk food taxes, and increasingly we're seeing that there is a positive influence of this type of fiscal policy on reducing sales and consumption of these foods. So again, when we're thinking about young child diets, there is a great need for further research on what type of restrictions can work when we're thinking about junk foods and young children. But I think a lot of what we've seen for older children is a way to start the discussion when we think about these solutions. Thank you very much. Next slide. Thanks.
Thanks so much, Alyssa. That was terrific. I want to actually go back to one of the slides you showed, I think it was slide number 2, that had the pictures of all of the products, just for the audience to see that this is the first food environment in many places around the world, and this is what children are eating. There's not a single fruit or vegetable or anything that grows in nature on this slide. I'm sure it's part of the ingredients, of course, of many of these products, but this is the reality that we're dealing with. And so as we think about our Q&A, and this is going to be an exciting part of the session here, I want to pose this question to all the presenters. The UN Food System Summit is upon us, and it's a real opportunity to drive some really innovative and groundbreaking policy. So I'm going to ask each of you for your one recommendation for governments to adopt in the next year to transform first food systems. And Alyssa, I'm going to go ahead and start with you.
So given I focus so much on nutritional quality in my presentation, I'm going to have to say, thinking about nutrient profiling as a way to really evaluate the healthfulness of products. And again, thinking about your point, Lucy, it's not just one category of food, but it's thinking about the range of foods that are out there. So there might need to be different elements that are considered for different types of products, but we can't think of these things in isolation. There has to be an across the board consideration to make sure we're really safeguarding child diets.
Thank you. Joe, how about you? What's the one policy recommendation that you would want to see governments adopt in the next year?
So if Alyssa's team are working on improving the nutritional quality of foods across the board, I would be supportive of that team too, but my team would also be working in parallel on introducing sort of a solid joined up approach to introducing regulations that address the marketing of foods and the full range of the first foods that we've been discussing today, so that would be a full implementation of the code, full implementation of WHO 69.9 and the WHO set of recommendations, so that the way in which these foods are marketed do not undermine parents' confidence in following recommendations, so that parents are empowered to choose home-prepared, nutrient-rich foods, and that that social and behaviour change communication that is important will work because it's not being undermined by aggressive and inappropriate marketing. And I think if we take a joined-up approach addressing all of those aspects, then we won't have any loopholes or gaps that Alyssa was mentioning. So yeah, that would be my call.
Great. And Leslie, I imagine you would underscore that. What else would you add?
Yeah, of course. The first thing that popped into my head was, getting countries to fully adopt and implement the code, and also have, really strong enforcement and monitoring mechanisms. I think that's something that's really still missing and something that's key. And I know that's something that WHO and UNICEF has been working on. But I also think sort of tangentially, the food system and the health system really need to work together. And part of that is really helping health workers provide quality counseling to mothers before, during, and in the postpartum period to breastfeed, and getting rid of conflicts of interest, which are part of the code, so that the health system isn't also promoting these commercial products. So that's where I would hope to start.
Thank you. And Phil, I want you to answer that question as well, but I'm going to ask a related one. So last month marked the 40th year anniversary of the code, yet only 25 countries have comprehensively adopted the code into national law. So what do you believe is holding back code implementation? And yeah, and I'd love to hear your response to that first question as well.
Thanks so much, Lucy. So one of the challenges with transforming a system is that it is a system, right? And so we need to take comprehensive action to change the system in its totality. And choosing a single action is very difficult. But if I was to choose a single action, I would also choose comprehensive and full implementation of the International Code of Marketing of breast milk substitutes for products 0 to 36 months, and also extending the code. So advocating for new WHO World Health Assembly resolutions that update and strengthen the code, and in particular, ending the participation of the baby food industry in national and international first food policy processes. So getting the baby food industry out of our policy space, okay? And we need to do that to protect the policy space. As you mentioned at the very start of this, this event, we need to protect the policy space that governments have available to them to protect, promote, and support breastfeeding. And that means getting the baby food industry out of the picture in terms of developing policy. Now, what's holding back worldwide code implementation? Now, we look at this question very deeply in our recent paper, and I think it's just one really clear and obvious one, is that the baby food industry has a globally coordinated lobbying network that is basically set up to do exactly that, block implementation of the code. And implementing that firewall, getting the baby food industry out of those policy processes could really, just be a game-changing solution to achieving that. But I would also just say, sorry, this is a long answer, comprehensively financing and implementing national first food policies, breastfeeding policies is also, again, just a really important action. We need funding. We need money for these breastfeeding policies. We need to fund civil society coalitions. We need to fund UNICEF and WHO to do this awesome work they're doing to support national breastfeeding coalitions. Thank you.
Thanks, Phil. You mentioned game-changing strategies and you mentioned money. So one of the questions from the audience from Ellen P. was, is what do you think of the idea of coordinated investor activism as a potential game-changing strategy for improving first foods? And I think that was directed at you, Phil. And I want to come back to this issue of industry at the policymaking table in a bit.
Thanks for that question, Ellen. This is a challenging question, and let me just say a few things. First of all, we know that divestment movements work. We've seen this in climate change. We've seen this in tobacco. We can convince and appeal to shareholders, investors to do the right thing, divest and move their money, reward companies that are doing the right thing, and remove capital and finance from those companies that are doing the wrong thing. However, there are just two caveats to this. One is that this is not a replacement for comprehensive and strong intervention by governments. Governments are obligated under international human rights instruments to protect the child, to protect the health of the mother. Financial advocacy is not a replacement for that. So that would be my number one point. My number 2 point is that there is a very real risk that the companies themselves co-opt these financial investment frameworks. And we've seen this with the FTSE for Good, the FTSE for Good investment index, for example. Nestle has become a member, Reckitt Benckiser and Mead Johnson has become a member, and they've systematically dropped the requirements for entry into that financial investment index. And that is through as far as I can tell, lobbying by Nestle. So Nestle's out there saying, we're a responsible company, we're part of this responsible investment index. However, we know that they're systematically undermining code implementation through their membership in these lobby groups all over the world. So that doesn't square. So there is a real risk with just relying on that approach, but I think it is potentially a useful one with those caveats. Thank you.
Thanks. We've had a couple questions come in around thinking of some of these commercially produced complementary foods, as well as milk formulas, BMS, as ultra processed foods, and framing this discussion around first foods through a lens of ultra processed foods being sort of the problem that we're dealing with, because of course it's not just about the nutrients in these foods, it's about the degree of processing, and as scientific evidence is emerging around the links between ultra processed foods and obesity and other diseases. So I want to get Joe, Alyssa, and Leslie to perhaps comment on that point.
I can jump in first. I mean, I don't think I'm going to be able to provide a full answer, but I think it's a really relevant question. I'm really glad that it's been brought up, and I think Phil and I, for example, have conversations about it a lot, and it's something that needs to be progressed. I think looking at taking the WHO Europe model that was developed for the purpose of looking at commercial complementary foods. It is a category-based product that sets both in terms of nutritional composition and also ingredients and also sort of flavors and naming. So it's it's more of an evolved nutrient profile model approach, I guess, in a way, because that's what we've recognized with this product set of product categories. It's quite complex. And so already we're looking at additional elements. I think there's definitely scope to think about how can we incorporate level of processing into that. Now I would flip the question around and say, to ask others, how can they help us turn some of the existing nutrient profile models to respond better in terms of the level of processing? Are there certain ingredients that we can look out for, and as an indicator of level of processing? Certainly there are some ultra processed foods that the model already picks up and says this should not be labeled as appropriate for this age group. Cookies, some of the sweet snack foods, it's that should not be labeled as appropriate for this age group. So it is doing its job that way, but I think there's further work that could come in to reflect the growing evidence. But of course that's also something that we would need to discuss with our colleagues from WHO as well, with regards to sort of global nutrition guidance in this space. But certainly it's a conversation worth having. But I'd love to hear the views of other people on this, because this is an age group where the ultra processed diet does start, unfortunately.
Exactly, and as Grania pointed out, taste preferences form in these early years. So Leslie, what would you add to that?
Yeah, thanks. And I think that just really highlights how much protecting and promoting and supporting breastfeeding is just critical, and even ensuring that women during pregnancy have a nutritious and safe diet, because we know that and also during lactation, we know that what the mother eats then can get into the breast milk and can kind of form taste preferences. So getting away from as Alyssa and Joe were talking about, getting away from those, having kids have early taste for sugar and unsavory things. It's really critical to look at also the maternal diet, but I think just having comprehensive programming to support breastfeeding, is critical to sort of establishing these first tastes, these first food preferences. But also, we also know through evidence that breastfeeding can help reduce overweight, obesity, and chronic illness. And it's just one of the first pieces that falls along. So we need social behavior change communication programs. We need interventions within the health system, but also within the food system, as we've been discussing.
Thanks, Leslie. Alyssa, I'm interested in your perspective on this, but we've also had some questions or comments in the Q&A around conflicts of interest. And one question I'm really interested in getting your thoughts on as well is on voluntary and self-regulatory measures versus mandatory efforts for improving the nutritional quality of commercially produced foods. So maybe take those two in tandem, please.
Sure. When it comes to the ultra processed foods, I think it's a great question. And I think that a lot of the discussion around ultra processed food has focused on junk foods and snack foods, and a lot of the research looking at the health outcomes for these. But ultimately, breast milk substitutes are an ultra processed food. And when it comes to commercial complementary foods, many of them fall into this category. You know, they're, as Joe mentioned, they're confectionery items, they're snack foods. It's not just the nutrient quality that we need to be concerned about. There are other elements of highly ultra processed foods that can really set up children on an avenue that doesn't go into a good direction. So it can be things like, so again, not just sugar content, but things like additives and emulsifiers. And we don't really understand what that means for young children in terms of health and nutrition outcomes. And I think that's an area that is really of importance to look further into. And also, as I mentioned in my presentation, the high hyperpalatability of some of these foods. And it's not just that they are high sugar, but the entire processing system results in textures and other elements that make them very easy to eat and to continue to eat, which we as adults are well familiar with. So in terms of your question about conflict of interest and mandatory versus voluntary or self-regulatory efforts, I think the evidence is becoming quite clear. I think, you know, as Philip mentioned, what we need to do is to get companies out of the policy-making decisions, because when that happens, we see that we're leaning more towards self-regulatory and voluntary efforts, because it's a hard decision and not a hard decision, but it's a hard effort to have something that's set up as a mandatory regulation. So we're seeing examples where that's not the case, and the results for example, in the UK, there's been a target set for sugar reduction for junk foods, and that has shown to have mixed results across companies and across different types of junk foods as it's being addressed within companies, versus there's in the UK a sugar tax for sugar sweetened beverages that's become a levy and it's mandatory. And we're seeing, similar to what we've seen in Mexico, where that tax is also mandatory, that the results of that are more effective. So my opinion is stick with the evidence, and what the evidence is showing is that mandatory is what really works, but it's not the easiest necessarily, for the reasons that Philip pointed out.
Indeed. So as we're coming to a close, I want to ask each of you for sort of your last minute comments on any of the topics that you covered, or the questions that are still being posed in the Q&A. But I also want to put this back in the context of the Food Systems Summit. So how can we ensure that FIRST Food Systems are well represented in the Food Systems Summit outcomes, and that really FIRST Food Systems are looked at as foundational to overall food system transformation. So I'd love to hear reflections from all of you on that, and I'll start with Phil.
Thanks, Lucy. So recommendations for the FIRST Food Systems Summit. Well, food systems are food systems. There should be about first foods to final foods in life. It should cover all foods, irrespective of age group, and that includes first foods. And if we leave first foods out of the picture, and recognizing that sustainable food systems are for future generations, it makes absolutely no sense to leave breastfeeding out as a core recommendation, to leave first food systems out as a core focus of the Food Systems Summit overall. I'd also recommend, first food systems are systems. To transform a system, we need to comprehensively intervene across the system. And we know from systems thinking, systems frameworks, the most powerful way to intervene in a system is to change the paradigm, to change the values that sit at the center of the system. Okay, my recommendation would just be simply this. We need to give human rights, and especially the rights of the child, priority over property rights and the profits of companies. That should be the fundamental driving principle that guides all decision-making in relation to first foods and first food systems at the UN Food Systems Summit and in general at the Food Systems Summit. So thank you very much. I'd also just like to make one quick point about this topic of ultra processed foods, something I'm very passionate about, as Joe mentioned. I think we need to convene some sort of rapid technical process looking into and investigating how ultra processed foods relate to first foods. This topic of the harms of ultra processing are not just about the nutrients. Nutrient profiling does not address some of these other harms that we're seeing in the evidence base now about ultra processed foods. So I just strong recommendation there for convening a technical process, WHO or UNICEF or both or other around this topic. Thank you very much.
Great suggestion. I'm sure others will endorse that. Leslie, how about you?
Yeah, thanks. And, I think Phil summed it up quite nicely, but I think this is a great first step. I mean, I think, raising awareness about this issue, about the lack of breastfeeding and complementary foods within the food system is a great place to start, and sort of highlighting the role that, yes, the food system does have a huge role, as we've all laid out, in impacting young children's diets and everyone's diets, as Phil was saying, and so it's not just promoting and protecting breastfeeding is not just a health system issue, it's also a food system issue, and that's I think that's why conversations like this are so important. And I hope we can today and in future events we can reach people outside of the health system audience to understand and appreciate and become advocates and champions for that. So thanks.
Absolutely. Joe, how do we elevate this in the context of the UN Food Systems Summit?
Yeah, well, I'll keep it brief because I think Phil and Leslie can come and work for UNICEF any day. They've been advocating for the priorities that UNICEF would like to see in the Food Systems Summit. And actually, one of the things that we are trying to do towards the pre-summit, at the summit, and beyond is elevate the key considerations for young children's diets in the food system conversation, and make sure that all of these elements we've been discussing today are there. And whether, I think ideas are still taking shape, how we ensure this fits in with all the other competing priorities, but UNICEF is clear: food systems have to deliver for children, and they have to deliver from children from the start. And whether that's a coalition of actors, whether that is coalition of the willing coming together to make sure that the first food system issues are prominently addressed, and that it's all about action as well. The action beyond the summit is the most important thing. And how can we continue this sort of conversation that we've been having today, identify the priorities that we've identified today, how can we take those forward? So yeah, looking forward to working with everyone on that.
Great. And then last but not least, Alyssa, excuse me, I want to get your remarks.
Thank you, Lucy. I mean, I completely agree with everything that's been said already, and I think that I will also keep it short and really just say that this is, this bringing all of us together, thinking about all these different types of commercial foods that are being consumed by children is this first step, and not thinking about things in silos, but really quite holistically and as part of a system. And I think, to other points that have been made about this, again, I think and that there's been great work that's been published recently thinking about child-centered food environments and child-focused food systems. And I think don't lose sight of the fact that food systems they include children, and we need to make sure that we think about the ways that companies are marketing and targeting children when we're thinking about solutions.
Thank you for that. And this has been such a terrific session. I really appreciate all of your presentations and the great work that you all have put in to preparing for today's session. Thank you to the audience for all of your wonderful, thoughtful comments and questions. This session has been recorded and will be up, I think, on the WHO YouTube page that features the week's talks. We're looking into how we share the presentations from this talk, and so we can come back to you with that information soon. And to close us out, I'd like to turn the floor over to Larry Grummer-Strong, who masterminded this webinar. Larry is a unit head at WHO's Department of Nutrition and Food Safety. So Larry, bring us home with your wise words and your rallying call to action.
Okay, thank you, Lucy. And thank you to all of the speakers today for setting the stage on this. I think a clear message came from all of these talks. The first food system is broken. It is failing our children, and we have to do better. There's no debate about how we want our children to be fed. WHO and UNICEF have clear recommendations on this. Basically, every pediatric association around the world, every nutrition association, there's very little debate. We all want our children to be breastfed. We know it's the best. We want them to be fed with locally available, natural foods that are nutritious. We want them to be eating fruits and vegetables. We don't want them to be having junk foods. We don't want them to be getting into the foods that are going to create obesity and non-communicable diseases. It's a clear message, and no one disagrees. Parents understand what their children ought to be fed. But we have a food system that is the antithesis of all of that. We have a food system that is fighting against breastfeeding. It is trying to convince parents that there's a better alternative that is convenient, easy for them to turn to when the slightest issue happens, address every possible problem they might have with raising their children. They're going to find a formula that's going to address it for them. We know that formula is necessary for some babies, but we don't need to be promoting it. The problem is not with the existence of breast milk substitutes. The problem is with the way we are promoting it as if it ought to be a good alternative to breastfeeding in general. We also have a problem with the complementary foods that are being portrayed as the healthy way to feed our children. When we actually look at what's in these foods, they are not healthy at all. They have high sugar content, high salt content. They're put in ultra-processed, they're created in ultra-processed ways, put in packages that do not raise children in a way that they understand how they should be fed. And we have a system that pushes junk foods on little tiny babies so that they are taking this as the convenient, tasty way that they're going to grow up and affect their health not just now, but throughout their lives, because this becomes the normal way to be fed and sets them up for a lifetime of ill health. We have to do better than this. This is a unique year that we have in bringing together the world, in looking at our food systems and saying it's time to look at this differently. How are we going to reshape the food systems so that it promotes health, not profit? We can do that. We're going to have these conversations over the next 3 months as we come together with the pre-summit and the summit. But we have to make sure that children are put first in these food systems. We have to look at these issues. We can't ignore this and say, oh, well, that's just being taken care of by a healthy food industry out there. No, it's not a healthy food industry. It is fighting against the ways that we all know that children ought to be fed. We need to step up and speak out and call for action. The webinar today has shared numerous ideas of concretely what do we need to do to reformulate foods, to change the way that they're marketed, to collect data so that we understand what is the problem and can document that for our policymakers so that they are ready to take action, and how we need to remove conflicts of interest so that policymakers can actually stand up for the human rights. We know what we need. We know the time is to do it. We need to take that action now. I want to thank Lucy for your wonderful moderation and the insights that you had for all of the speakers, tying all of us together and keeping us thinking through the complexities of these issues. To Phil, Joe, Leslie, Alyssa, for your wonderful comments. I also want to thank Jorgen, who did much of the back scenes, keeping us all organized, getting the logistics working together, moving this whole webinar along. And finally, I want to thank our participants today. You are the voices that can carry this issue forward as we move into September for the summit. Please don't just let this be one nice webinar that you attended in early June. Let this be something that really changes your actions to make sure that the first food system is prominent at the Food Systems Summit and going forward. Thank you very much.
Thank you all.